Welcome to the Speechie Show. Being a speech-language pathologist often means having too much work and not enough planning time. To beat the overwhelm, we're bringing you the tricks and tools that will make your job a little bit easier. Hello, everybody, and welcome to the Speechie Show. I am your host, Carrie Clark from speechandlanguagekids.com, and we are here today with Teresa Richard from Mobile Dysphagia Diagnostics. How are you today, Teresa?
Hi, Carrie. Good. How are you?
We're good. We're excited to have Teresa on today. We are talking about dysphagia and what you need to brush up on if you want to start treating swallowing patients. So a lot of times, our school-based SLPs may be interested in picking up some extra hours. Maybe they're looking at a change of venue, and it's been a little while since we were in grad school. So we're talking about what's up to date on swallowing and swallow studies and kind of all the information that you need to know about that. So we are going to go ahead and get started with that. I have a couple things I want to announce, but I'm going to wait till a few more people hop on the call. So Teresa, why don't you go ahead and introduce yourself and tell us a little about what you have going on right now?
Yeah, so I'm Theresa Richard. I'm board certified in swallowing. I own a mobile swallow study company, Mobile Dysphagia Diagnostics. We do mobile fees, which is actually, it's a tiny endoscope that goes in the nose and then gives a top-down view of the swallow. So that's what we do. We contract with various skilled nursing facilities, rural hospitals, and we take the equipment right to them. So can be just an alternative procedure to the modified barium swallow study that everybody knows about. So, but they're both comparable. They both have pros and cons of what they can assess, but they're both very necessary in what we do. So, and then I also have a blog over on my website also with a lot of dysphagia resources and things that we need to know. And then I also have a podcast coming out this Friday called Swallow Your Pride. So just talking about all the latest and greatest research. I mean, so much. Even I graduated from grad school over 10 years ago, and I think everything we do now is so different from then. So
absolutely,
it's a great evolving, emerging field with so much great new knowledge. But unfortunately, some of us that haven't been in grad school recently may not know all of it. So.
Yeah, well, and even when I was in grad school, I don't think we got a ton of swallowing. You know, it was like one little half a credit course, and that was it.
Yeah, and that's the problem. I mean, there's some great medical SLP programs out there, but just the general curriculum. I mean, I would not want to be a dysphagia professor these days. There's so much to cover, and it's hard.
Yeah, absolutely. So we're going to jump into that. We're going to share 5 tips that you need to know and brush up on if you are going to be looking into treating swallowing patients. But before we do that, I do want to mention our hearts go out to everyone down in Texas and all of the flooding that's happening there. If you haven't heard, the Speech and Language Kids, we are offering free light memberships to anyone who's been affected by the flood. So if you have lost your speech therapy materials, you're afraid you might have lost them when you get back to your schools, we're setting you up with free light memberships so you have access to our worksheet library. And you can get that by emailing us at carrie@speechandlanguagekids.com and just let us know that you are in that situation. You can also find the information over on the Speech and Language Kids Facebook page. So we do need your help. If you know someone down there who could use this, go over to the Facebook page and either tag them in the comments or share it with them in some way so we can spread the word. I don't actually know anybody down there in Texas, but I know that there's a lot of people that are probably out of their homes, out of their schools, and missing some materials. So hopefully that'll help, but go ahead and share that around so that everybody who needs that can get access to it. All right, let's jump back in here. We are talking about swallow studies and treating swallowing patients. So in the comment section below, go ahead and type in, would you feel comfortable walking into a room and doing a swallow study right now? Would you feel confident to do that? My answer is no. I wouldn't have a clue.
I hope your answer is no if you've been out of the field for a while.
Yeah. All right. So why don't you start us off? We're going to talk about our first tip is going back to the anatomy and the physiology, which I knew really well when I passed my praxis, but let's talk about it now because I don't.
Yeah. I mean, it's the basis of everything we do. We have to know the anatomy and physiology of the swallow. There's some great textbooks out there. I know everyone pretty much had the Logeman textbook of 1998 seems to be the swallowing Bible, but the treatments in that we know so much more now. But luckily the anatomy and physiology doesn't change.
Hey!
So if you still have that textbook, use that. But we have to know what muscles we're treating. There's so many we have great evidence-based treatment strategies now. We have electrical stimulation, things like that, but you have to know the muscles that you're treating. So the whole point of speech therapy, dysphagia therapy, is to improve the muscle, improve the swallow. So we don't just want to throw, a crutch on it. We have, thickened liquids, which are great, but they're essentially just a crutch. So they should just be used temporarily just to help us get over that hump while we're rehabbing the swallow. But again, you have to know what muscles you're treating, what muscles you're targeting in order to do the right treatment strategy. So I think that's a big thing when, I have people contact me. I'm thinking of, I work in the schools, but I think I'm going to pick up some PRN hours. What should I do? And I'm like, do you remember any of the muscles? No. All right, well, let's
start there.
So I know it sounds really, I really don't want to go back to grad school, but there's some great up-to-date resources that can get you caught up, and it'll come back pretty quick, I promise.
Yeah. Do you have some information on anatomy and physiology on your website, or what's your favorite place to send people to?
My actual favorite thing, Dr. Ianessa Humber out of Florida has I believe it's on Northern Speech Services. It's the Swallowing Pocketing Guide. It's just nice. It's like a 10-page, it's literally a pocket guide, a little thing. I think it's about 10 pages and just goes through and highlights all the muscles. I do have some information over on my blog in the Cranial Nerves series. We'll get to that next, but that's just a great small resource that you can get over on Northern.
Perfect. Excellent.
Yeah.
All right, so we've talked about you need to learn the anatomy and physiology again. The other thing you need to be looking at and relearning are those cranial nerves. I believe there is a song somewhere that's about the extent of what I remember.
Yeah, there's a couple different songs. A couple different people have come out with songs. But again, the brain controls the muscles. So we have to know where those deficits are. So if they had a stroke, we've got to know what's been impacted, because that, again, is going to impact the muscles, which is what's going to impact what treatment we choose. So I do have an entire long cranial nerve series over on my blog. There's a lot of great CEU courses to take, but that's really going to help to tailor your treatment also. So, we'll get into doing instrumental assessments and doing fees and MBS, but just at the bedside, that's something that you can do to give you a little more knowledge about your patient right away.
Perfect. And what is your website again where people can find the cranial nerve stuff?
Yeah, so it's Mobile Dysphagia Diagnostics.com and then just /blog to get to all my blog posts.
Perfect. Check out the cranial nerve stuff over there. Excellent.
Yeah.
Okay, so we relearned the anatomy and physiology. We relearned the cranial nerves. Once you got that back in your head, let's talk about the instrumental exams and what that looks like. I'm sure that's changed a ton over the past years too. Absolutely.
So bottom line, we know we cannot diagnose and treat what we can't see. So Dr. Stephen Later did a study a few years back. 70% of the time we're overdiagnosing swallowing disorders at the bedside, and 14% of the time we're missing silent aspiration completely. So there really is a wide range. We just don't know what we're treating at the bedside. So we have to have access to instrumental assessments. And luckily that's evolved so much too. We now, if you have access to modified barium swallow studies, there's the MBS-IMP training course, which even if you aren't going to be doing the swallow studies, that's a great way to brush up on the anatomy and physiology. So that looks at 17 components of the swallow.
Oh,
so
wow.
I know some people think, well, in swallowing, there's the oral phase, the pharyngeal phase, and the esophageal phase. And true, but we know way more now. So the MBS-IMP looks at 17 different components, which that's just a great course to brush up on too.
Yeah.
And then I do, like I said, I do mobile fees, which is a small endoscope that goes in the nose and gives us a top-down image of the swallow also. So it doesn't matter if you want to use MBS or fees, depending on your situation, but you need something. You need to see where the deficits are, and again, what muscles we need to treat. So we don't just want to know, are they aspirating or not? It's important, but we want to know why, so that we can treat it properly.
Perfect. Okay. if anyone's having any questions as we go along here, go ahead and type those in and we will be answering questions as we go along. Okay, so now I have to ask this. When I was doing my internship in the hospital, which is the extent of my swallowing experience, we would use like the stethoscope and listen to see if they were aspirating. Is that just not even a thing anymore?
It's not, Carrie. It's actually, you probably didn't even know this. It's a huge topic on the dysphagia boards lately.
Oh, really?
Yeah. Because that's just one of those things that's been disproven. You cannot accurately hear aspiration I know, and it's what we did because it's what we thought.
Well, that makes me feel so much better because like my supervisor was like, listen, you'll hear, and I'm like, I don't hear anything.
I know. And it doesn't mean anything anyway. I mean, the stethoscopes are for listening to the lungs, right?
Yeah.
They're for lung sounds. That's what they do. They don't work on the neck. So, yeah.
I love it.
Yeah.
All right. So get rid of your stethoscope, guys. Just throw it away.
Please. Yeah. I'm begging you.
Perfect. All right. Anything else on instrumental exams?
I don't think so. You need to have access to them. That's all I say. So if you're going into a facility, you're looking to do PRN somewhere, ask ahead of time. Do you have access here? Do you have a contract with anybody? Mm-hmm. Make sure they do, because it's really going to limit your job and you really can't do it appropriately if you don't have access to it.
And then you would recommend just seeking out training based on whatever equipment is available at the job you're looking at?
Well, yeah, usually the way that it works is most facilities have contracts with different companies.
Perfect.
So either they have a contract with a hospital next door, or they have a contract with a mobile fees or a mobile MBS company that comes in and does it for them. So it really just matters that you have access to it. So
Perfect.
Yeah, if you're going to just be doing PRN or something, you may not want to go get trained to do them. And a lot of facilities don't have the equipment there. They just have contracts. So it's just important to make sure you have access to those contracts.
Absolutely. And so, also you're not relying on your bedside evaluation that may or may not be accurate. So
Right. Absolutely.
Perfect. All right. So the next thing on our list is EB exercises. Tell us what that is.
Yeah. So evidence-based practice exercises. I mean, I think what you think of with swallowing exercises is the oral motor exercises that we did, 10, 15 years ago. Those were actually designed for head and neck cancer. So just,
Super.
I know, right? So just to keep the muscles moving that way. They are not, if you think of going to the gym, you're not going to just do a bicep curl 10 times and say, okay, my muscle feels great, ready to go home. And that's essentially what we're doing when we think of doing these oral motor exercises with wagging our tongue back and forth 10 times. You're not providing any resistance to that muscle. You're just doing a movement. So those are essentially called oral motor movements. They're not taxing the muscle. You're not providing any resistance to the muscle. So that's kind of been a big thing in the last 5 years, is we have a lot more treatment strategies now, just going back to the basic physiology of how muscles work. So you have to provide, you go to the gym, you pick up a weight. You have to provide resistance to those muscles in order to strengthen them and make them improve. So there's lots of different strategies now. There's chin tuck against resistance. There's expiratory muscle strength training. There's the IOP, which is a tongue bulb that helps with tongue lingual resistance. So there's just a lot of different exercises now that if you've been out of the field a while, you probably don't know.
Yeah.
So I am getting ready to do a huge blog series on breaking down all of the new evidence-based treatment strategies. So
fantastic.
You've been out of the loop for a while. If you want to hop on and get the updates from my blog, you'll know when that'll be coming out in the next couple months.
Perfect. Yeah, I'm sure that will help a lot of people, because I don't remember even the ones that they taught us back then, and I'm sure those are probably outdated anyway. So
yeah.
Perfect. Okay, so if you are with us on Facebook Live, stay tuned. We are going to do some giveaways here in just a minute, but we have one more tip to share with you, and that is mentorship. How can mentorship help us through this process?
Yeah, I mean, you really probably shouldn't even consider taking a PRN job or taking a job unless you have somebody that can kind of show you the ropes. So if they're just looking for an extra person to help out, a third or fourth person to add to their staff, that's great, because then you have a couple other people to bounce some ideas off of. But if they just want you coming in and seeing patients on Saturdays all by yourself, and you have no one to bounce things off of, that's doesn't end well for anybody. So really seeking out a mentor ahead of time It'd be great to have someone at your site that you can have as a mentor also, but sometimes that doesn't work out so well. But even anybody locally, if you can contact your local university, see if they know people that have experience with swallowing, and see if you can just, I know I have a couple people that I've just mailed packets of info to. I've emailed, these are all the things like we just talked about, refresh the anatomy. This is what you do for a cranial nerve exam. Here's some new evidence-based treatment strategies. So, just having somebody that, if you've been out of the field for 10 years and looking to pop back in, that can kind of help to get you up to speed and tell you what the good CEU courses are to take kind of before you go diving head in.
Absolutely. That's wonderful. All right. If any of you have any questions about dysphagia or any of the things we've talked about today, go ahead and type those into the Facebook comments. But we're going to share some resources. So where do people go if they need some help? Where do you send them to?
A new group on Facebook. It's called the Med SLP Newbies. So that's kind of, I know a lot of people are nervous, afraid, don't even know where to start. They don't even know what questions to ask in these dysphagia groups. Some think they're too silly. So this is kind of just we're calling it a safe space to come and ask some questions, just get some guidance. I've got some great people that have jumped in there and are answering tons of great questions for me. So,
good.
I'm kind of blown away at how much support has gone on in that site. And then, like I said, I've got my podcast coming out this Friday. It's called Swallow Your Pride. If you go to swallowyourpridepodcast.com, you can sign up for updates there. And I'm going to be posting the show notes every week. It's up on iTunes, so you can go subscribe now. But I've been blown away with the people I've interviewed so far on there. I've had some great researchers, and it's almost like a free hour-long, CEU course.
Yeah.
So you're not getting CEUs for it, but I'm just, as much knowledge and depth as we've gone into it, that I think has been great. It's really surprised me. So tune into that. And then, like I said, my blog on my website has some good sources.
Perfect. Okay. And will you put the links to those in the comments of the Facebook post?
Yes, ma'am.
Perfect. So if you have any, if you want to get to any of those resources, just wait till we finish the show here, and then the links should be down there in the comments. You may have to kind of scroll a little bit if we have a bunch of comments in there. All right. Olivia says, to be properly trained in fees, don't you have to have so many passes with disordered and normal swallows?
Yep. And I actually have an entire blog post about that. Yes, you have to attend a 2-day basic training.
Okay.
And then depending on your state laws too, will depict how much further training you need after that. But the ASHA guidelines are kind of gray in that you need the 2-day basic course, and then they suggest 25 abnormal patients. So basically someone supervising you hand over hand, watching you pass the scope. So that's kind of ASHA's guideline, but each state does have a lot of different variables. Some states even require you to have up to 50 passes before you're deemed competent and independent to do it on your own.
Okay, that's good to know. And I'm sure there are, certain employment opportunities that have the ability to have somebody there watching you for that.
Absolutely.
So, excellent. Yeah. All right, great. Okay, well, that's what we have for today. We are going to do some giveaways here on Facebook Live, so stick with us here if you are on with us. And today we have, Teresa does not have a giveaway that she's doing today. She is going to tell you about a giveaway here in just a sec on her podcast. But for today, we're going to do 2 giveaways of the speech therapy solution. So if you're not familiar with that, that is my membership site just for speech language pathologists and other professionals. And we offer training, we offer materials, worksheets, we have a worksheet library, and we just got authorized to do CEUs through ASHA. So starting next month in September of 2017, we are going to start the ASHA CEUs. And if you sign up before the end of this month, which is Friday, you will get to lock in a lower rate before the price jumps up for those ASHA CEUs. So if you are interested in more details about the speech therapy solution, you can head on over to speechandlanguagekids.com/join. But I am going to offer 2 free months to the first 2 people that answer my question here on Facebook Live right now. So here's the question. Are you ready? At what grad school did you get your master's? We're going to have a grad school prompt in here, since we were talking about how a lot of us, it's been a while since we were in grad school. So let's take you back to your grad school days. Everyone write in on the comments what your grad school is. Mine is Truman. I'm wearing my shirt today. Truman State University. All right, Blake Brown says Appalachian State, and Rosa Perez says Texas State University. Wonderful. Thank you, guys. All right, Blake and Rosa, you guys will win the 2 free months in the membership. Blake, I believe you are already in the membership, so we will add 2 months onto yours. And Rosa, I'm not sure if you are or not. So both of you can contact us at Carrie, C-A-R-R-I-E, at speechandlanguagekids.com, and we'll get you set up with that. Congratulations. All right, we got another one, Southeastern Louisiana University. Fabulous. All right, thank you all so much for joining us today on the Speechie Show, and thank you so much, Teresa, for coming on. Where can people find more about you and what you've got going on over on your sites?
Yes, if you want to follow Mobile Dysphagia Diagnostics on Facebook, I post a lot of updates there. And then if you go to my blog at mobiledysphasiadiagnostics.com/blog, you can sign up for the updates there. If you go to swallowyourpridepodcast.com, you can sign up for those updates. And so like I said, it's going to be released on iTunes this Friday, September 1st. And then for the entire month of September, we're going to be doing a huge giveaway at the end of September for people that are subscribed through iTunes and leave a review of how much they love the show.
Yay! So definitely get over there and get your subscriptions in so that you can get in on the giveaway over in September.
Yeah.
All right, perfect. Thank you all so much. Don't forget to head on over to speechandlanguagekids.com/join and check out the membership. Don't forget to sign up before the end of August if you're interested so that you can lock in that lower rate. And also, if you know anybody in Texas who's been affected by the flood, please send them over to our Facebook page. We have a post about offering free memberships to those who have lost materials in the flood so we can help you replenish your stash. So head on over to Speech and Language Kids Facebook page for that. All right, thank you all so much, and we'll see you next week. Bye for now. Thanks for joining us today on The Speechie Show. We hope today's tips have helped you feel a little less stressed and a little more confident about your work. If you're looking for more stress busters and confidence boosters, we'd love to have you join us in the Speech Therapy Solution, where you'll get access to a huge library of premium training videos and another library of print and go therapy materials. You can also get help with your tough cases by joining Carrie on the weekly Q&A calls or by posting in the exclusive Facebook group. Plus, group members can join us for a monthly webinar that can be used for continuing education credit. Head on over to speechandlanguagekids.com/join to check out all the amazing benefits of the Speech Therapy Solution membership. Bye for now.